you know, 6'6" and 300 pounds, you're probably going to take, you'll take the extra large cuff. But it's best to go ahead and do it before you go over there. If you think they might need the extra large cuff, go ahead and put it on there and take it over. That way you're not trying to get them in one and you have to say, well, I need to get the other cuff. It's pretty simple to change the cuffs. It's just a little thing that pulls out, and then you can just slide it back in there. Okay, pretty easy. But for Nick, I'm going to put the regular back on. All right. So, is there a pillow? There's one in the hall. It's I won't. We can get it or not get it, but we've got armrests here. So for blood pressure, so I'll say, Nick, we're gonna do blood pressure and get a heart rate. Okay, and I usually there are 4 questions that are in that section. I usually ask those questions at the end, but you can ask them at the beginning or the end, whichever you want to do. Okay, so what I'll do is, so Nick, we're going to take your blood pressure on your left arm. Okay, you can just relax your arm and put it up here, and I'm just going to roll your sleeve up just a little bit. You can lift your arm just a little bit. Okay, does that feel all right? Mm-hmm. Okay, so what's going to happen now is when we start blood pressure, the cuff will inflate. Okay, you'll feel some pressure, and then it'll deflate, and then we'll get the reading for blood pressure. Okay, so all right. So what you'll get is reading for systolic and diastolic. Okay, it's really out. It's right there in the front. So systolic comes across here and diastolic, and then you'll get a pulse. Okay, which is going to be their seated heart rate. All right. So when you fit the cuff, we always fit. We measure in the left arm. Okay, unless there's some issue with the person's left arm. Okay. If there's a table, you're welcome right next to the person. You're welcome to rest their arm up on a table. Okay, but the pillows are going out. I don't know if they're working. Do you think they're working or? Okay, so it's just to raise the arm a little bit so that they're not hanging down like this, and they're not trying to hold. They shouldn't have to hold their arm up. Okay, they should be able to rest their arm comfortably. Okay, palms up. All right. So these are very simple to set up. The green, see the green thing, lines up basically in the middle of the arm. The tube runs down the arm. Okay, you make sure there's no kinks in the tube. You're not, twisting it up. All right, and it says in there, but it's about 3/4 of an inch to an inch above the bend in the elbow. Okay, the cuff is snug to the point where you can fit a finger in, but it's pretty snug when you fit a finger or two in. Okay, you shouldn't be able to turn the cuff. Okay, and then the biggest issue, you can tell me if it's been an issue. It's summer, so it may not have been, but is sleeves. Okay, you should be able to roll their sleeve up all the way so that you can get the cuff directly on the skin. If you have to, one of the biggest issues is when rolling the sleeve up, if it gets so tight at the top that it starts to constrict the arm, it can be an issue. If it seems to be an issue as you get them to start to roll their sleeve up, if it's possible for them to pull that one arm out of that sleeve, okay, so either just take that arm out, or if they have a shirt on underneath, they can pull the arm out. Has it been an issue with sleeves? Have you guys had any issues with sleeves? Okay. I mean, obviously, if they have a jacket on, you just have them slide their jacket off. Okay. So, did anybody follow me through? Did I miss anything with blood pressure? left arm.
I will just say a